Here's a comprehensive overview of doxycycline. 1. Basic drug information. Generic name, doxycycline. Drug class, tetracycline antibiotic. Dosage forms, capsules, e.g. 100 milligrams, tablets, e.g. 50 milligrams, 100 milligrams, delayed release tablets, oral suspension, intravenous IV injection. Brand names, Vibromycin, Dorix, Oracea, Monodox, Adoxa, Acticlate, Morgidox, Targadox. Definition: doxycycline is a broad-spectrum tetracycline antibiotic used to treat a wide variety of bacterial infections, as well as certain parasites. It inhibits bacterial protein synthesis, thereby stopping bacterial growth. 3. Mechanism of action. Doxycycline binds to the 30S ribosomal subunit of bacteria, blocking the attachment of aminoacyl tRNA to the mRNA ribosome complex, thereby inhibiting protein synthesis. It is bacteriostatic, stops bacteria from multiplying. 4. Indications, uses. Respiratory tract infections, e.g. pneumonia, bronchitis, acne, urinary tract infections, UTIs, sexually transmitted infections, e.g. chlamydia, syphilis, Lyme disease, malaria prophylaxis and treatment, anthrax, including inhalation anthrax post-exposure, periodontitis, skin and soft tissue infections, rickettsial infections, e.g. Rocky Mountain spotted fever, cholera, plague, Q fever, tularemia. 5. Contraindications. Hypersensitivity to doxycycline, tetracyclines, or any component of the formulation. Children under 8 years old may cause permanent teeth discoloration. Pregnancy, especially in the 2nd and 3rd trimester. Severe liver dysfunction. Use with caution. 6. Before taking this medicine, precautions. Inform your doctor if you are pregnant, planning pregnancy, or breastfeeding. History of liver or kidney disease. History of esophageal disorders or swallowing problems. Exposure to sunlight, increased risk of photosensitivity. Interaction with other medications like antacids, iron, calcium, or oral contraceptives. Inform your doctor of all medications and supplements you are taking. 7. How to use. Take with a full glass of water, preferably on an empty stomach, 1 hour before or 2 hours after meals, but may be taken with food if it causes stomach upset. Do not lie down for at least 30 minutes after taking to prevent esophageal irritation. Follow the full course even if you feel better. Dosing information. General adult dose varies by infection. Standard infections, 100 milligrams every 12 hours on the first day, then 100 milligrams once daily or 50 milligrams every 12 hours. Acne, 50 to 100 milligrams once or twice daily. Malaria prophylaxis, 100 milligrams daily, starting 1 to 2 days before travel and continuing for 4 weeks after leaving the area. STIs, 100 milligrams twice daily for 7 to 10 days. Note, always follow your doctor's prescribed dosing. Missed dose, overdose. Overdose, take it as soon as you remember. Skip the missed dose if it's almost time for the next dose. Do not double up. Overdose symptoms, nausea, vomiting, diarrhea, dizziness. Seek immediate medical help or poison control. 10. Stop or avoid taking if severe allergic reactions occur, e.g. rash, itching, swelling, difficulty breathing, severe gastrointestinal distress or persistent vomiting, signs of liver damage, yellowing of skin, eyes, dark urine. You become pregnant while on the medication, consult your doctor immediately. 11. Side effects detailed. Common, nausea, vomiting, diarrhea, loss of appetite, sun sensitivity, photosensitivity, tooth discoloration, especially in children, esophageal irritation or ulceration. Serious allergic reactions, rash, itching, swelling, difficulty breathing, liver damage, intracranial hypertension, persistent headache, vision changes, Clostridium difficile associated diarrhea, blood disorders, e.g. eosinophilia, thrombocytopenia. 12. Vital information. Avoid direct sunlight or tanning beds. Use sunscreen. Do not take with milk, antacids, or iron supplements within 1 to 2 hours of dosing. Always complete the full course. Notify your doctor if experiencing severe headaches, vision changes, or abdominal pain. 13. Other drugs that will affect doxycycline. Drugs that may decrease effectiveness. Antacids containing aluminum, calcium, or magnesium. Iron supplements. Bismuth subsalicylate, Pepto-Bismol. Seizure medications, e.g. phenytoin, carbamazepine, barbiturates. Drugs affected by doxycycline. Oral contraceptives, reduced effectiveness, Blood thinners, warfarin, increased bleeding risk. Methotrexate, increased toxicity. Retinoids, e.g. isotretinoin, increased risk of intracranial pressure. Thank you. Have a nice day.